I'm Jenni Heuberger. I am a nurse practitioner. We're here at the Newvue Dermatology, Aesthetics, and Wellness in Kirkland, Washington, and I am joined by one of my practice partners. This is Dr. Sung, a very well-respected bariatrician, bariatric surgeon, and general surgeon. And we're here today just to answer your questions and to let you know how we, as a practice, along with Dr. Jennifer Gardner, who's a dermatologist, and Dr. George Min, put together a whole full circle for women's health. And one of those things is that when a woman comes to me or to Dr. Sung and she is at a point in her life where her hormones are changing, maybe she's out of her childbearing years or she's coming out of her childbearing years, but she's starting to find that her body is changing in multiple ways, we can work together to help to make those changes not be so significant and or to help improve quality of life, because quality of life is always better than quantity of days. But if we have a great quality of life, which we can do not just with medicines, sometimes we can do that just by talking to patients and getting them in contact with the right people, then we can increase their quantity of days. So that's what we're here to do today. You want to take it away?
Yeah, so I am a double board certified bariatric surgeon and obesity medicine specialist. I've been in practice for over 11 years, and a large number of my patients are women, especially when you look at the bariatric data. 85% of our patients are female. That can be a whole another talk in regards to why that is. And a large proportion of that 85% are post-menopausal women who are struggling with not only their weight, but more importantly, their body composition, their central adiposity, their visceral fat, due to the hormonal changes, the loss of skeletal muscle, and the increasing deposition of fat in the belly, and which can, in regards to weight, sometimes lead to 1.5 pounds per year during times of menopause, perimenopause, and postmenopause. So a significant demographic of my particular practice when it comes to metabolic disease and weight loss. And it used to be one of the more difficult patient populations to really have a dramatic outcome. But over the years, as we have specialists and experts like Jennifer here, we've learned a lot more about menopause, especially in relations to weight and body composition. And with the advent of medications, things like GLP-1 medications, endoscopic surgery, bariatric surgery, we can have a dramatic impact on a woman's overall health, especially in regards to menopause and weight gain and weight loss.
I think one of the things we know is that 1 in 3 women will die not from menopause and hot flashes and night sweats, but from cardiovascular complications, whether that's heart attack or stroke. And what's so under known to people is that 1.5 pounds a year, when you're talking about maybe it taking a full 10 to even up to 15 years to really go all the way through from being a woman who's just starting to experience some changes with her periods to a woman who's 10 years out from her last period, that then we're looking at 10 or 15 pounds where that weight might come on really easily, but it doesn't come off really easily. And muscle doesn't get replaced by fat per se, but muscle just becomes weaker, and we become weaker overall, and that leads us to a lot of other complications. So when we can't work out and we can't really help our bodies and help our metabolism, and sometimes we need the advice of someone else who can help us do that, because 1.5 pounds over 15 years is 22.5 pounds, I think, which is about 4 dress sizes or so, 4 or 5 dress sizes for most women. And that doesn't include all the other things that happen, the extreme tiredness, the feeling like your pants never fit, the bloating, the weight gain, the problems with your tummy where your gut just doesn't work the way you want it to. And yes, so that is why we work together to try to make this happen, because no, you're not crazy. And I hear it from my friends and I hear it from my patients. You know, I don't like the way I feel. I wish I felt better. And I think the biggest takeaway is that if you have questions, you just come and ask. And people are afraid to do that, especially women, because we've always been taught that, you know, those are just things that you don't talk about. You just deal with it on your own. But the reality is 40% of a woman's life will be lived after her last period. And that's a big chunk of life to live. And nobody wants to live that with dry skin and being obese and not being able to take care of their kids and their grandkids, or go on vacation, or, you know, walk their dog and live a healthy and normal life. And so it's just so important that we can work together and that we can work with you as patients to make life better, because there's answers.
Yeah, and so that number's only going to grow in terms of the percentage of life that's spent after their last period. As women are living longer, the lifespan is longer, so they gain the quantity of life, but unfortunately the quality of life is going down. And we're seeing that where women are starting to catch up to men in regards to the complications that are related to visceral adiposity or increasing visceral fat. You know, weight gain is not all the same. It depends on where the weight gain is coming from. Is it fat? Is it muscle? Is it water? But when it comes from fat, especially visceral fat, that's why women are catching up to men in regards to the rate of heart attacks and strokes.
When you say visceral fat, for everybody who's answering, you mean
Yeah.
fat in the belly,
That's
right?
correct. Yeah. So we're talking peripheral fat is fat around the hips, the chest, the arms, versus visceral fat, which is the fat that's inside our belly, around our intestines, in our liver, around our kidney, even around our heart. That is the metabolically active and dangerous fat, right? So as women live longer and more women are going through menopause, they're having those hormonal changes, having changes in their body composition when they are losing lean body mass and gaining visceral fat. So the trade-off is they're living longer, however, they're developing more complications from the changes in their body composition, which is why it's alarming that women are catching up to men in regards to those cardiovascular type complications like heart attacks and strokes. So it is really important, and it's actually very, very appropriate, since it is, Women's Heart Health Month and everything, to talk about that.
I think the other thing, and you can comment on this too, is that one of the nice things about all of us working together is that we are not approaching this just from one side versus another. We're approaching this from the inside out and outside in. So not everyone's complaints are the same. That's why all of these things, obesity is a syndrome, and a syndrome, or menopause is a syndrome. And what that means is if you have an umbrella, under that umbrella could be hundreds of different things, but you have to just have one. Now menopause means you have to have a stoppage of your periods, right? And obesity means you have to be of a certain weight or BMI class, right? But there can be a whole interplay of other things going on. And so that is why it's good to get multiple minds together to deal with one singular problem, because it really isn't truly one singular problem. It's lots of problems together. And I don't tell a lot of my own personal stories, but I would say that if I would have had an option to do what I do for my patients now and to see someone like Dr.Sung, I would have done it 10 years ago, instead of having to try to really dig, scrape, and scratch and figure out what all is going on for myself. And so I think it's just really important that when questions arise, and this is regardless of race or abilities or anything else, these are just all issues that all women, all people who were born female may encounter at some point in their life. And so it's just important to keep us all healthy and keep going.
Yeah, especially when it comes to obesity. Obesity does not discriminate based off of gender, ethnicity, socioeconomic status. It's an equal opportunity disorder. What obesity is the only disease that affects every single secondary organ system from head to toe. So,
and that's everything from your brain and your heart to your gut and your liver.
Your reproductive health.
Yep.
Right. So that's why the synergy and the overlap is so important when it comes to the comprehensive wraparound services that we can offer here. As we said before, from the outside in and inside out, because they all go hand in hand. And
so what can you speak to? I know sometimes people will say, well, you work in an office that also has a plastic surgeon, and so does that mean everybody has to have surgery, right?
Right.
So what would you say is sort of the lead up? I mean, I feel like I know that pretty well, but if I'm coming in and I say something to the effect of, this is how I feel, and I'm wanting to move forward in like my weight loss journey, and my hormones are being treated, but now I'm having maybe some issues with my sugars. Maybe I have some glucose intolerance, and that's because my hemoglobin A1C is going higher, or I now am, really wanting to be on a journey to lose weight. Do I have to have surgery, or what are some kind of initial treatment things that might be included, although these might be different for every single person who might come in?
Right. So that's a great question. So fortunately here in my practice, in our practice here at Newvue, we have experts like Jennifer here, where the basic is to start with a very comprehensive history and physical, right? Because when it comes to weight, especially weight gain or obesity, it can be multifactorial. It can be very complex. Despite what people may think or believe, it is not as simple as calories in, calories out. It's not a moral failure. It's not a lack of giving it the good old college try. It's very complex, from environment to our food supply to medications that we in the medical field prescribe to our patients for certain diseases that causes weight gain. It causes, affects insulin, or just even insulin itself that we prescribe to treat diabetes. All these things can affect and cause weight gain. But so it first starts out with a very comprehensive history and physical. We spend at least an hour with our patients, getting to know them and understanding that, because sometimes there is an underlying etiology. It could be something as simple as hypothyroidism, which is not simple, it can be complex, but if we don't think about those type of things and we immediately go to medication or surgery or something like that without actually addressing the root cause, then we may not actually be helping the patient. So when patients come to me from Jenni, that's not, they come in with in a box with their bowl wrapped on top. But if they're not, then yes, we start out with a comprehensive hour-long session where we're doing a consultation, getting to know them. And then we then sit down with patients during that hour and find out, what are your goals with weight loss? How much weight do you want to lose? What type of time frame? And are there specific medical conditions that we want to address more than others or sooner than others? And based off of those things, and then for me medically, based off of their BMI, their medical conditions, we can sit down and talk about options. The beauty with our practice is that we offer comprehensive weight loss care. So for myself, being a double board certified weight specialist, I'm board certified in obesity medicine by the American Board of Obesity Medicine, and I'm board certified and fellowship trained in bariatric surgery. So what that allows for our patients is they have then access to comprehensive weight management. And that could be starting out with medical weight management, with or without medications. Same thing that you counsel your patients, right? Part of the treatment for menopause or for PCOS and other disorders for women's health. Dietary lifestyle changes, counseling them on nutrition, counseling them on their activity, counseling them on getting at least 7 to 8 hours of sleep per day, minimizing stress, staying hydrated. Those are the 5 pillars when it comes to weight loss, basic foundation. But most of our patients have done that. We have lots of patients who said, I've done the Weight Watchers, I've done the Newvue, I've done the Jenny Craig, keto, you name it. That's typical. The issue is not losing weight, it's keeping it off. And our body's very good at fighting us the whole way through. And it's made more difficult when we're in menopause or perimenopause and our body's working against us.
I think it's really one of those things that, like, when we are, I always like to say that I like to meet my patients where they want to be, not where I think they should be. And the reason for that is that I have heard so many times, I said this and this is what I got. And it was so far in between. And, when we talk about things like treatments, and we're talking about things like menopause and weight loss and all kinds of things, I think that, again, like, a comprehensive exam is good. I know I have some people that are like, oh wait, I really have to have a pap smear? Yes, you do. It's typical, it's normal, right? We have to check all parts of your body, right? Just like we would order blood work, right? It's just important to keep you healthy on all levels and then meet you where you want to be. And, I have some patients that are like, my goal is to be able to walk my dog 3 times around the block. Just 3 times, because right now I don't have the energy, I don't have the stamina, and I can't do it. So, okay, how do we get you and your dog 3 times around the block? And I have other patients that say, hey, I was a marathon runner. I don't necessarily want to run marathons, but I want to be able to get out there and do stuff. And so I think, treatment is based on all of those things. And when you add in not just the sideline, the weight component and how people feel about themselves, and I think there's like underlying disease, and it's not always physical. Sometimes the disease can be, and I think it always does have a mental component. And I think that's true whether you talk about obesity or even if you talk about menopause and perimenopause. There's just a lot more anxiety, there's a lot more depression, there's a lot more questioning yourself all the time, how you feel as a person. Why do you act the way that you do? Why, do you feel like one thing used to work and it doesn't work anymore? Excuse me. And so really trying to delve into that. Both my parents were teachers, they were both educators, and I feel like I said, I'm not gonna go be a teacher because I don't wanna have to deal with that. But honestly, 99% of what I do is education. And so if we can take what we do with patients and we can teach you how to have a better lifestyle, and you can take it and run with it so that you can walk your dog and you can be with your kids and you can be with your grandkids. And Dr.Sung does a really good job of sharing when his patients are okay with it, sharing his patients' journeys. And I'm always really intrigued to watch because they go through so many stages, and how you can literally see in those videos, even if they didn't say anything, they just stand up a little taller and their faces are just a little bit brighter and their skin just looks a little bit better, and that's regardless of whatever they have done. And I know some of you wanted us to address treatments and specific treatments, and I think the best way that I can put that forward is that there's everything from hormones to not hormones to Western medicine to non-Western medicine to referral to other providers to working on plans on your own, and all of those things can play a part. And just like I was saying, you can have an umbrella of symptoms, I think you can have an umbrella of treatments.
Absolutely.
And here at Newvue, we have multiple patient rooms, and what I like to tell patients is I have 12 patient rooms and I could have 12 women all with the same issue, and I could do 12 different things. And that is why we customize care, because it is not about a cookie sheet. This is not a full meal deal. We're not going through a drive-through. This is not drive-through medicine. This is actually true medicine where we sit and talk and make a relationship with your patient. And if that is what you want for health, that is what we're here for.
I can't emphasize that enough. I think that's one of the distinguishing characteristics of our practice here at Newvue, is that exactly what Jenni said, that it sounds like a really crazy concept, but if you actually listen, take the time to listen to the patient, they can actually probably tell you the diagnosis and give you the treatment plan. But we as clinicians have to have the luxury to be able to spend that time, which we do here in our practice, and two, the desire to listen. And it sounds so foreign, but it's such a simple concept. And so we're able to do that here, which then also then builds a lot of trust and rapport with our patient population here. But that's so important, and that's when you're able to then, as you said, meet them where they want to be, instead of us kind of dictating where we think that they should go and how we think they should go and how to get there. And so we're able to offer that type of comprehensive care simply by being able to have that empathy, connecting with the patients and taking that time, because it is really important. But that's what helps me to then help create a customized plan in regards to someone's weight loss, because there's so many options out there. I'm sure you're familiar with them.
Mm-hmm.
But especially when it comes to treating perimenopausal and postmenopausal women, that can be difficult. But fortunately now we have very good medications and surgical and non-surgical techniques that can give that particular patient a fighting chance to work on their body composition, their metabolic health, and some weight loss. And we've had numerous mutual patients who've done so well with that comprehensive wraparound approach.
Yeah, and I think they're shocked that we can do all of that in some ways because they've never experienced that.
Right.
Or if they've experienced some of it, it's within a very large system, and so it might be a good 6 to 9 months in between when they are able to really get answers to questions, and sometimes those things are not the big issue anymore, and sometimes there's other things that have trumped those things and made them bigger issues. So yeah, it's really a great system. I mean, when I started here, and most of you I think that know me know I started working in the Newvue office, taking insurance in September of 2022, and so when I started doing that and people started coming over, I think they were just shocked that there was so much we could do for patients, that they had never seen that sort of comprehensive care. And when you can come full circle and do everything kind of, I don't want to call it a one-stop shop, but in some ways it is a one-stop shop. It's just a more focused based one-stop shop. So
yeah, I mean, I can think of one patient that comes right to mind. We had a patient who started out as a patient of mine, and postmenopausal, also had polycystic ovarian syndrome. Her BMI was 32. She weighed about 192 pounds, and she had struggled with weight her whole life. It was a very interesting story because her husband actually had a vertical sleeve gastrectomy, lost over 200 pounds, and has maintained his weight loss. She was eating like him. He was doing all the meal prep, and so she was eating like him, exercising like him, but because of her metabolic condition, she could not lose that weight. But even though she saw the benefits of the sleeve gastrectomy, she did not want to have surgery. And then came to our office for some aesthetic type of care, and saw that I was at Newvue now and offered the endoscopic sleeve gastroplasty. She elected to go and have that procedure because it's non-invasive, It's not surgery. We're using a gastroscope to go into someone's stomach and to plicate and sew the stomach from the inside. And that, for her, in terms of the risk profile, was to her appetite, that she can stomach that kind of very minimal risk. And she did phenomenally well. She lost 100% of her excess body weight with the endoscopic sleeve gastroplasty, despite being postmenopausal and having polycystic ovarian syndrome. And then she followed up with Dr. Min, our board certified plastic surgeon, and had body contouring so that, you know, how she looked on the outside could fit how she felt on the inside. And then she followed up with you for her women's health and for her menopausal care, which she was ecstatic about because she didn't know that existed. But then when she found that out, she was able to get an appointment with you right away. She was struggling to get into her gynecologist in the big health hospital systems. And then she had a separate reaction to some other antibiotic for a different condition, that she had some kind of infection. I think it was an ear infection or something, or a throat infection.
She came to see Dr. Gardner.
And so, you know, we told her that we have a dermatologist here. You can see her today. And was able to come in and be seen on an urgent basis, and figured out that she was having an allergic reaction to a medication that was prescribed to her by some other provider, and had that addressed. And she was so over the moon, like happy with her care, because it was all here, and it wasn't wait 2 weeks, a month, 4 months to see somebody. It was in real time, literally come in the same day, next day, and see the subject experts in this local area. So that one patient for me, I think just kind of like encompasses what is possible and what we do here at Newvue Wellness and Aesthetics. It's just the complete package in regards to that.
So there were other folks that asked questions about hormone replacement, and I will briefly just say that I think the thing about HRT and NOT is that it is extremely individualized, and so the best thing to do is to come in and talk to me. And because we're going to talk about family history, we're going to talk about current history and past history and all kinds of things. But we also got some questions about GLP-1s. People like to say GLP-1.
Right.
Can you sort of start from the very beginning and explain what those are? Because I know that for some people, GLP-1s are injectable, and some people, GLP-1s are not. Some people use them for diabetes. Obviously, they're really popular right now as a form of weight loss. There's also been some issues where pharmaceutical companies and insurance companies are really clamping down on the use of some of those medications. And so maybe just if you want to start from square one, what is a GLP-1 so people know, and why, and then once you explain those, then maybe why someone who was put on something like metformin or glyburide or something like that, why then they're being switched to a GLP-1, or why it would work for them, or why it wouldn't work for them.
Yeah, so that's a great question. So this is a kind of a big topic and a very, very hot topic right now. GLP-1 basically stands for glucagon-like peptide 1, and it is a gut hormone. And so it's a naturally occurring hormone in our body that helps us to regulate hunger, cravings, and satiety, the feeling of fullness. So after we consume a meal, once the meal and the nutrient contents hit certain parts of our digestive tract, it then sends signals, and these signals are these GLP-1s, some of them, they're called incretins, the class of hormones, the gut hormones that GLP-1s are part of. And so they can then give negative feedback to the brain saying, okay, we've ingested a meal, we're starting to see the nutrients, GLP-1 gets activated to tell the brain we're full, we're satisfied, slow things down, delay gastric emptying, so that we don't eat anymore because we're satiated, we're full. So these medications initially were indicated for treating type 2 diabetes, because not only do they work on our gut, but they also work on our pancreas. So they work on beta cell production, insulin production, and that's why they were originally created to help treat type 2 diabetes. However, during the research with these medications and the utilization of these medications, there was noticed that there was actual significant weight loss on top of that. So I've been using GLP-1 medications, the earlier generation medications, off-label for weight loss for close to a decade now. It's just much more difficult now because of all the
And those are more oral medicines versus injectable medicines.
Both.
Yeah.
But,
okay.
So I primarily focused on the injectable. So those are medications like Trulicity, Victoza, going back to like liraglutide, the older GLP-1 medications. It's only recently that there have been 2 FDA-approved injectable medications for weight loss in regards to GLP-1s, and that was Wegovy, which is semaglutide, and then recently tirzepatide was FDA-approved several months ago for weight loss. These are the exact same medications as the existing GLP-1 medications for diabetes. So Wegovy is semaglutide, which is the exact same peptide as Ozempic. So they're the exact same thing. Ozempic's for diabetes, Wegovy is for weight loss. When it comes to Zepbound is the exact same medication as Mounjaro. So that is tirzepatide. They're the exact same peptide. Mounjaro is for type 2 diabetes, and Zepbound is indicated for weight loss. Zepbound is a little different because it is a GLP-1 and a GIP, so it works on 2 gut hormones, which is why you typically see a little more weight loss. But in regards to weight loss, the primary function is delaying gastric emptying. So when people eat, they get fuller sooner, they stay fuller longer, and that's because your stomach isn't emptying as fast. When we get to certain doses, then it does start to affect the satiety centers in our brain, so we're not really as hungry, we're not craving things as much. And people typically can expect to lose between 15 to 20% of their total body weight being on these medications.
So if someone is 200 pounds, and that for them is being overweight or obese, and they're on these medicines, then, you know, with their coaching, with close follow, with dietary compliance and these medicines, then we could look at potential weight loss in the 30 to 40 pound range, right? For
That's
some
correct.
of those folks.
Yeah.
So certainly getting their body mass index back down. And so another question in regards to GLP-1, so when it's acting upon those peptides that we normally have, so when some folks will say, oh, he or she is fat because they just eat too much, can it be that for some of those folks to actually add back some of these medicines, then we're adding back maybe something that they were missing that didn't give them to that point of satisfaction, like the other folks who maybe are not so heavy don't have, or they have those peptides that say, okay, it's time to stop eating, or where sometimes when people are much larger or obese, or really, really obese, we would say morbidly obese, maybe they don't have those proteins, or they don't have it in the same amount, and so that's where those injectables really help them out.
That's correct.
Yeah.
Yeah, so I mean, there's a dysregulation in the neuroenteric, meaning from brain to gut access, and some of these gut hormones that regulate hunger and satiety. So, you know, between leptin and ghrelin, ghrelin being the hunger hormone and leptin being the satisfaction hormone, there's a dysregulation there. And so despite someone having excess weight, they can't regulate it because of the hormonal imbalance. And so these GLP-1 medications are able to hormonally help them at least have a chance to work on that in terms of the dietary and lifestyle changes that can lead to weight loss. So the way I interpret these medications is my patients tell me that it really takes away the food noise, the kind of chatter that's kind of in the background. It's one of the things I notice right away. But it really makes it, to quote some of my patients, much more manageable, right? It allows them to have a little bit of a pause so they can be a little more mindful and conscious about what they're putting into their body. Is what they're about to ingest going to serve a purpose nutritionally, emotionally, spiritually, physically, right? Whereas before the GLP-1 medication, they would tell me it's constantly like, I'm thinking about my next meal. And it's no matter what task they're doing, it's just constantly like just in the back of their head, there's that little chatter about food. And this just, quiets that. Just like anything else we offer, whether it's going to be GLP-1 medications, endoscopic weight loss, surgical weight loss, these are all tools to help modify someone's behavior, modify the lifestyle in an effort to help promote weight loss.
Yeah.
What else is?
So what I would say is, so we're gonna just sort of wrap this up for folks, but this is something that we would like to do for you regularly if you would like us to do it, which is address something like today we talked about peptins and GLP-1s, we talked just about our practice and kind of what to expect when you come here to Newvue and any part of Newvue Medical. I think in the future, a couple things that I would like to address with all of you and talk about are things like, this is Women's Heart Health Month. We're in the middle of Go Red for Women and the American Heart Campaign, and heart health is intricately linked with all the things we've discussed today. So I think that might be something we talk about in the future. I'd be more than happy to discuss cancer risks with people, post-cancer treatments, post-surgery treatments. What do we do when we lose all of that weight? What comes next, right? What happens when we go through these surgeries and for women we start having periods again when we thought that was done, right? How do we protect our fertility? How do we stop becoming fertile if we don't want to do that anymore? Where are we at in our lives? How does that affect our whole family component? And I think in the future we can address some of those issues, and I think we'll probably just break these down for you in little 5 to 7 minute segments, and certainly if you want to come in and see us, we're available. So Dr.Sung is at Newvue Plastic Surgery and Medical, and the phone number over there is 425-483, is that right? 463-9883. And I'm here in the Kirkland office, which is Newvue Dermatology, Aesthetics and Wellness. And that phone number is 425-300-6656. But you can find us both in all of our information and information about what we carry, what we do, what insurances we take, who our estheticians are that are intricately linked to helping us out at www.newvuemedical.com. We're there, and you can also submit questions in there. So if you think of something later that you'd like to ask us, fire away and we'll answer in the next episode.
Yeah, and I think we also hope to have some of our own patients here.
Yeah.
I think it's one thing to hear from ourselves as providers, but it's another thing to hear from our patients who are the actual ones living with menopause, or having gone through weight loss, or currently actively treating excess weight. So we, hopefully we can have some patient testimonies. Really, what I see this type of forum is obviously educational, but also an opportunity for you to get to know us. I think to have these type of conversations, to get to know us, to trust us, and to just kind of put the name and the personality behind the face and of Newvue. I think hopefully this allows you to get a kind of an inside glimpse into that, more personal type of glimpse. That hopefully
we can delve a little bit more into where we went to school and why we decided to do what we did, and from family side and whatever. But we're going to wrap it up today. I'm off to baseball tryouts.
I got daddy duty as well.
And you're probably off to soccer practice or swim. So we're going to let you go, but have a wonderful afternoon, and we'll see you again here at Newvue.